Hi, I'm Patty Cassondra. I'm a family nurse practitioner with a specialty in sexual and reproductive health. We've put together a series of vignettes for you that are demonstrating patient-centered reproductive goals and contraception counseling skills. The healthcare providers are played by real clinicians, and the patients are played by actors. We have two different sets of vignettes, and in one of them, we stop periodically to tell you which skill we're going to be demonstrating. And in the other one, we play it straight through for your viewing pleasure, just like a movie. We hope you enjoy them. The following videos demonstrate how to operationalize patient-centered counseling about reproductive goals and contraceptive preferences using the PATH framework. This framework is a concrete set of open-ended questions and counseling skills designed to effectively engage with patients about their reproductive goals and, when appropriate, pre-pregnancy care, contraception, and infertility services. PATH is an acronym. The PA stands for parenting or pregnancy attitudes, the T for timing, and the H for how important it is to prevent pregnancy. PATH asks the following three questions. For the PA, do you think you might like to have children at some point? Or if the person's already had children, do you think you might like to have more children at some point? The T, when do you think that might be? And the H, how important is it to you to prevent pregnancy until then?
Good morning. My name's Cassondra.
Hi.
Nice to meet you. And you're Alyssa?
Yes.
All right, great. Can you go ahead and give me your last name and date of birth?
Yep. It's Peterson and November 13th, 1989.
Okay, great.
Cassondra proactively apologizes for Alyssa's wait. She takes responsibility, is not defensive, and focuses on Alyssa's experience.
Thank you so much for waiting. We had a patient earlier this morning that needed some extra time. I hope that this didn't mess up your day too much.
Oh, no, actually it's fine. I had a chance to look at the chart and look some stuff up on my phone. And honestly, it's nice to just take a break from my life for a minute.
Well, I'm just gonna log in here, okay? It'll just take a moment.
Cassondra is efficiently using the time while she is logging in to ask about Alyssa's life. This small talk can fit into the nooks and crannies of the visit, time that could otherwise be wasted.
So tell me about your life. Are you working or in school?
Or both. I work as a server at night, and then I'm a student full-time right now, and I'm actually studying to be ultrasound technician.
Oh, awesome.
Cassondra builds rapport by remarking on the fact that Alyssa will be working in healthcare and then validating her determination. This is pointing out positives. Notice the many more instances where Cassondra points out positives in this vignette.
So you'll be joining us in the wonderful world of healthcare.
Yes.
Welcome.
Thank you.
I've actually heard that that's a great career. But how do you juggle it all, work and school? I mean, you must be quite determined.
More like I've just had a series of crappy jobs since high school, and I don't know, I just need to do this for me.
Well, I see here that you're here for a well woman visit. Is there anything else that you'd like to talk about today?
No, I think that's it. This is my first PAP, and I am like 100% not looking forward to it.
Cassondra's face, body language, and words show no judgment about the tardy PAP and show full acceptance of Alyssa's disclosure. Cassondra then gives positive feedback and demonstrates empathy.
And I know I should have come in a long time ago, but I'm gay and I didn't think that I needed this kind of a test. But then a friend from school told me that I should come in, so.
Okay. Well, your friend is right, and I'm really glad that you decided to come in today. I can see that this isn't easy for you. We can go through each step of the exam so you know what to expect.
Rather than making assumptions, Cassondra asks Alyssa about her concerns. This is followed by validation and a positive statement. Cassondra then gives information and a follow-up question. Cassondra uses follow-up questions after she gives Alyssa information throughout the vignette.
Is there any part in particular that's concerning you?
Well, it's super embarrassing.
I get that a lot.
And it doesn't hurt too much, right?
You're right. So most folks say that they feel pressure, but doesn't actually hurt. Okay. Is there anything that you found in the past that makes things like this that might be hard easier?
Just knowing what's going to happen ahead of time and knowing who's going to be doing it.
We can go as slow as you'd like. I can stop at any time. And if you think of anything that I can do to make this easier for you, please let me know.
I will. I think I'll be fine, though.
Part of today's visit is us going through some reproductive health care questions together. Are you okay with that?
Yeah.
Okay, great.
Cassondra asks path. No adaptation is needed for Alyssa's sexual orientation other than to ask in a non-judgmental and non-gendered way about exposure to pregnancy.
Do you think that you might like to have children at some point?
No. Well, yes. I would like to have a kid someday, but I'm hoping that my future partner would be the one to carry the baby. I just don't really see myself enjoying pregnancy.
Okay. And do you know when that might be?
Well, I have to find a girlfriend first, so there's that. But once I'm done with school, I should be able to support a kid, so.
Okay, well, it looks like you've put some thought into this. Now, I don't want to make any assumptions, but I don't know if you ever have sex with anyone with whom you could become pregnant. And if you do, how important is it for you to prevent pregnancy until you finish ultrasound tech school?
Yeah, no, actually, I do. I have a friend, and we both have a little, bedroom rodeo whenever we're both single. But honestly, it wouldn't really be the end of the world if I got pregnant.
Okay.
Cassondra paraphrases and offers relevant services based on what Alyssa has said. Note the phrase, ways to be prepared for a healthy pregnancy, with no mention of the word plan since Alyssa did not say plan.
So I'm hearing you say that you'd prefer to prevent pregnancy now. So would you like to talk about options for contraception?
Sure.
I'm also hearing you say that you don't completely oppose the idea. So if you'd like, we can also talk about ways to become prepared for a healthy pregnancy.
Maybe let's talk about the birth control, because I truly don't actually want to get pregnant.
Okay, fair enough.
This question focuses on Alyssa's preferences for particular characteristics of a method rather than on which method. Later, Cassondra will ask, and what else? Until a clear picture of Alyssa's preferences emerges. Cassondra will offer to discuss methods with the characteristics Alyssa has said are important to her.
Do you have any sense of what's important for you in a birth control method?
I was on the pill in high school, and that was great for my skin, so there's that.
You're right. So birth control pills can definitely help with acne. So can the birth control ring and the birth control patch. Anything else that's important for you in a birth control method?
Well, my last girlfriend had really bad periods, and they told her to take the pill to completely stop them. And I mean, mine are okay, but if I had the choice to stop them, I totally would. Every month is just this reminder of what a drag it is to be a female.
I hear you. It sounds like you actually know some of the extra things that you can get from a birth control method. And it also sounds like you're pretty clear on what you want.
Yeah, I look things up, and I mean, even though my school doesn't really focus on these issues, I'm learning how to think about my health and my body in a different way.
So it sounds like your priority is to choose one of these methods here. So to help with acne, we can use the pill, the patch, or the ring. To skip your periods, we can do that safely with either the pill or the ring. Okay? You'll notice here that these methods we're talking about are on the second row of the chart. What that means is they work pretty well, but not as well as the ones here on the top line. Okay, and that just has to do with us being human and how we use them, typical use. Okay, but we can get more close to these effective numbers the more perfectly that we use these methods. Okay, so it sounds like we want something to help with acne, to help skip your period, and you're also okay with the level of effectiveness. Do I have that all correct?
Yes.
Great. Now, is there anything else important to you? For instance, if you choose the pill, it's something you'll have to remember to take every day. If you choose the ring, it's something that you'll have to put into your vagina and change once a month. Are you okay with either of those? Do you prefer one over the other?
Well, I use tampons, and as long as the ring doesn't hurt or feel weird in any way, then I would be okay with putting that in. Is one better than the other?
Not necessarily. They're very similar, actually. They both have a mixture of female hormones, estrogen and progesterone.
Cassondra uses an anatomy chart and previously an effectiveness chart as visual aids.
They both actually keep the egg in the ovary here, so it can't leave out here to meet the sperm. Actually, it's just the way that you use them that they're different. How do you think you would do if you had to take a pill every day?
Oh, I'm sure I'd be fine with that, but the ring does seem easier.
Okay. Would you like to go over the details of how to use the ring?
Is there a lot to know?
Not really. Mostly, the instructions that you'll get with the ring are written for somebody that does want to have a scheduled once-a-month bleed, like a period. Since you'd like to skip your periods, what I would recommend is you put the ring in the first day of every month, keep it in for that full month, and on the first day of the next month, take out the old ring and replace it with a new ring.
So it's like paying your rent.
It's exactly like paying your rent, except you actually get to save money on tampons. Would you like to start today?
Sure. Today isn't the first.
You're right. So it's not the first of the month, but it is actually safe to start the ring any day as long as you're not pregnant. Is there any chance that you could be pregnant?
Not unless my sex toys can get me pregnant.
Not the last time that I checked. So you can go ahead and start the ring today if you'd like. You'll have protection once it's been in for 7 days. Each ring has enough hormone in it to give you protection for at least a month. One way to think of it is that each month gets a ring. So this ring would belong to February, next ring would be for March, the next would be for April, and so on. The reason we offer the first of the month way to change it is just because it might be easier for some folks to remember. Okay.
Okay.
What we can do, I can give you a ring today. You can go ahead and put it in, and if you have any questions, I can check it. I can have you put it in right after we're finished with the exam.
Sounds good. I don't think I'll have a problem though.
Okay. I don't think you will either. Some people do notice some bleeding or spotting in the first few months as their body's adjusting to the hormone. If that happens, you can go ahead and take the ring out for 4 days, have a little bleed like a period, and then put the ring back in for the rest of the month. How would you feel about that?
Does that mean that the bleeding would stop after that?
Usually it does, with removing the ring and then putting it back in.
Okay.
Okay. If you do need to do that, it's really important to make sure that you don't leave the ring out for more than 4 days.
Okay. So, on to the fun part?
Yes. Before we get there, Alyssa.
Cassondra uses teach back. Notice how she points out that Alyssa could handle more information than usual. Cassondra takes the responsibility on herself by saying she wants to be sure she didn't leave anything out, rather than appearing patronizing.
I felt that I could give you a ton of information, more than I usually do, but I want to make sure that I didn't leave out anything important that you need to know. So can you please tell me how you plan to use the ring to skip your period?
Hey, good afternoon. I'm Dr. Brian Nguyen. It says here that you're seeing me today for an STD check.
Brian makes no assumptions about Kennedy's relationship with the person he had sex with. He doesn't say your new partner or seeing someone new, since this could have been a one-time encounter.
The assistant tells me that you're interested in getting tested because you've been with someone new. Are you experiencing any symptoms?
No, I just want to be safe, you know?
Brian validates and gives Kennedy positive feedback. Notice, as the vignette continues, how Brian points out positives and validates several more times.
You know, testing is a great way to take care of yourself and also to make sure that you're not transmitting anything to a new partner.
I try.
Well, if you're not experiencing any specific symptoms, then I can offer you a urine test for gonorrhea and chlamydia and a blood test for syphilis and HIV. Is there anything else that you wanted to discuss today?
No, not me. But I'm also here with this new girl I've been seeing. She's getting checked out too. And I'm hoping that she gets on birth control too.
It sounds like you're both invested in being healthy. What are you currently doing to prevent pregnancy?
Condoms. But that's why I'm hoping she gets on the birth control. My daughter, Kayla, comes from using condom or from not using a condom.
You know, you're not the first to mention this kind of thing happening.
Brian paraphrases and seamlessly moves on to path. Brian makes no assumptions and still asks how important pregnancy prevention is to Kennedy, even though he has been clear he wants no more children, because someone can want no more children and still be happy if one comes along.
It sounds like you are not ready for another pregnancy, but are you thinking that you might like to have more kids at some point?
Oh, no. I'm done. Like, done. I mean, don't get me wrong. I love my children so much, but I don't want any more kids.
I hear you. So, given that, how important is it to you to prevent pregnancy?
Well, it's very important to me, but most of the birth control is for women. It's not like I can make her use it. It's not my body. If she wants to use birth control or not, it's her body. All I can do is go along with whatever it is she wants to do.
It sounds like you see the importance of honoring the choices of the women that you've been with. And, you know, most of my male patients are frustrated that there aren't more birth control methods for men. And if it were available, I would prescribe you male birth control. But the science just isn't there yet.
Yeah, right. What's up with that?
I think it's like you said. We pay more attention to preventing pregnancy with women than we do with men, not realizing that men care about preventing pregnancy and being prepared for pregnancy too. Drug companies need to know that men want to use male birth control. In the meantime, I do think it's important that guys like yourself know more about women's birth control methods so that they can have a conversation with their partners. It's a couple's issue, not just a woman's issue.
Yeah. I get where you're coming from.
Brian introduces a visual aid that has been sitting on the table. Kennedy has already had a chance to look at it and start to formulate his thinking about contraception.
Did you get a chance while you were waiting to take a look at this chart? It shows the different methods of birth control and how well they work to prevent pregnancy. I'd be happy to explain any of them to you.
I saw that, yeah. But as you said, not much for men but condoms and just pulling out.
Well, has anyone ever talked to you about permanent contraception?
No. What's that? Like, birth control forever? No. I mean, unless you mean that thing where they tie guys' tubes.
Well, that's exactly what we're talking about.
Brian introduces the topic of vasectomy without assumptions. He replies to Kennedy with positive feedback plus validation, and he adds clarifying information rather than correcting him. He then asks a funny, therefore memorable, follow-up question. Phrases like, all juice, no seeds, can help Kennedy retain the information.
Vasectomy. It's a very safe and effective procedure that men can use to prevent pregnancy. And you're right, once you get it, you can forget it. It continues to work for the rest of your life.
That's a good deal. But doesn't that end up taking away a man's cum? And what about a dude's sex drive?
Those are excellent questions. A lot of men worry that vasectomy is going to affect their coming or their sex drive. Fortunately, vasectomy doesn't do either of those things. Or really, what would be the point of using it?
Right.
It actually blocks the sperm from getting into the cum. The way that I explain it, it's all juice, no seeds.
Brian asks, what questions do you have for me about vasectomy? Rather than, do you have any questions, which can discourage questions. In order to focus the conversation, he asks, what other questions do you have for me about vasectomy? Rather than just a blanket, what questions do you have?
So, what other questions do you have for me about vasectomy?
we enter a visit that is already underway. Condessa introduces a transition to path. Condessa skips the T in path, which is the timing-based question, when do you think that might be? This is because Jackie is 17 and gives no indication that she would like to have a child anytime soon. A provider may choose to omit the T in teens who have not expressed a desire for pregnancy.
And do you think you might like to have children at some point?
I'm really not sure. Probably. I used to think no way, because I've just about been raising my little brothers. But my sister has the cutest baby I've ever seen. So yeah, probably.
If you did at some point want to have children, how important is it to you to prevent pregnancy until that time?
Really important. My mother would kill me.
I know you mentioned that you and Michael are hooking up.
Yeah.
Okay. Are you interested in discussing your options for contraception?
That's part of why I'm here today.
The visual aid was in the room, so Jackie had time to look at it before the visit and then could refer to it during the visit.
While I was waiting, I was looking at this chart. I totally did not know that some types of birth control work really good, while others seem like a waste of my time.
Condessa agrees with Jackie, and then instead of asking, do you have a sense of what's important to you about your birth control? Condessa paraphrases what Jackie has said is important to her about her birth control by saying, it sounds like you like birth control that you can really rely on, and then adds, do you have a sense of what else you might be looking for? And gives examples of method characteristics. It is best to decide which examples to give based on the particular patient. In this case, Condessa could have said, for example, some methods of birth control are easy to hide.
It sounds like one of the things that you're looking for in your birth control, that it's absolutely effective. Do you have a sense of anything else that you are looking for about birth control?
I'd really like something that I don't have to think much about, because I've got so much going on with school and I have to watch my brothers, and honestly, I'm not that good at remembering stuff.
It sounds like you like birth control that you can really rely on and just forget about. Did I get that right?
Yeah, that's right.
Do you have a sense of what else you might be looking for? For example, there are methods of contraception that you can use for acne or painful periods, or even that can lower your chance of some types of cancer.
I do get super bad cramps when I get my period. Can birth control actually help me with that?
Immediately after describing the possibility of amenorrhea in plain language, Condessa asks a follow-up question which helps Jackie integrate the information.
Yes, absolutely. Some of the methods that you were looking at the top of this chart can help with your cramps. In fact, many people who use them get no bleeding at all or just light spotting or light bleeding occasionally. How would it be for you if you didn't get your period while on birth control?
I didn't even think that was possible. My abuela told me that it's not healthy not to get my period, so I don't think that's for me.
Condessa does not correct Jackie. Instead, she agrees with her grandmother and then goes on to clarify the information about the safety of amenorrhea while on hormonal contraception, using plain language and a visual aid. She immediately asks Jackie a follow-up question after giving her clarifying information.
Your grandmother was completely right. When you do not use contraception with hormones in it, you do need to get your period.
My abuela is awesome. We're really tight. I tell her everything. But what if my birth control does have hormones in it?
That's a great question. And it's interesting, when you use hormonal contraception, that makes the lining of your uterus really thin. That's the place, if you ever decide to have children, that's where the baby will grow. And if you see here, this is the lining, the inside of it. This gets very thin because of the hormones. And when it gets thin, it's as healthy as it can possibly be. Knowing that, how would it be for you if you didn't get your period while using birth control?
I think that would be pretty awesome. I really hate my period.
Yeah. Some of the methods here at the top of the chart can do all of the things that you say are important to you. Do you have a sense of anything else you'd be looking for in your birth control?
That's all I can think of. My sister has one of those IUDs. They gave it to her right after she had her little baby. She likes it. I might think about that, but it kind of freaks me out.
Condessa uses a tactile aid and later asks, "Can you tell me more about what freaks you out about it?" rather than reassuring prematurely before she knows what is concerning to Jackie. Also, Condessa doesn't ask why, as that can be perceived as challenging or indicating that Jackie shouldn't be freaked out. Next, Condessa responds with empathy before going on to clarify the information about pain.
Here's what an IUD looks like. Can you tell me more about what freaks you out about it?
Yeah, my friend said she heard it hurts a lot.
I can see how that can totally freak you out. And yes, your friend is right. Many people have some cramps or discomfort when we put it in. It can feel like bad menstrual cramps. And then it should go away. After it's in place, someone shouldn't have any pain. Does your sister have pain?
No, she never said she did. It's so small and soft. Does this one go up there also?
Condessa does not say no, yet replies to Jackie's question and uses 2 tactile aids.
This is called an implant. And this is placed under the skin of your arm. And if you feel right here, you can see what it feels like under your skin. Sienna, who brought you back, she has one and she loves to show people it. So if you're interested, we can ask her if she can show you her arm with the implant in it.
Yeah, that sounds quite interesting.
You said it's really important for you to prevent pregnancy, and this is the most effective of all the methods.
Rather than percentages, Condessa uses plain language, which is whole numbers and natural frequencies, a given number out of 1,000, and a common denominator.
If 1,000 women use this in 1 year, none, or at most one, might get pregnant. Compared to the pill, if 70 to 80 women out of 1,000 might get pregnant.
I never heard of this before.
Would you like to hear more about the implant?
So you're in your 3rd trimester now, and things have been going great, minus this little cold that you've got. Since we're entering the home stretch, it might be a good time to start talking about the future.
Jen begins the path conversation as a natural transition.
Do you think that you're going to want to have more children at some point?
We're a big family, and we have so many bills to pay each month. I'm definitely not asking for another child. Mm-hmm. But if he comes, I'm not going to be upset. You have this love for your children, and you've created them. Mm-hmm. You rise to the occasion and don't stop to think about all the bad things.
It is clear from Jen's body language and facial expressions that she is listening. She responds with validation, pointing out a positive without judgment or bias. Jen merely responds to Jayda as a unique individual with no agenda other than to learn about Jayda and build rapport.
That's really beautifully put. So, how important would you say it is for you to prevent pregnancy?
It's important to me. But if it happens, I'll be a little shocked. I'll be happy. I'm not going to be mad. I'm not going to be mad at all about it. I'd be happy. No matter what the situation is or whatever, you have to take care of them. It really wouldn't be a big change. Just another baby.
Jen uses a type of paraphrasing where she puts one of Jayda's desires, not to have any more children, on one hand, and the other desire, to be happy with another child, on the other hand. Apparent ambivalence does not need to be resolved. This technique shows Jayda the two desires so she can think about it and perhaps prefer one hand over the other. Jen uses the word but. Usually the word and is preferred when using the on the one hand technique.
So it sounds like on the one hand, you and your family would adjust if you had a new little one. But on the other hand, you'd ideally want to prevent pregnancy. And medically speaking, it's a good idea to space pregnancies by more than a year and a half or so. So that said, do you think this would be a good time for us to talk about ways that you can prevent pregnancy?
We've been talking about getting my tubes tied, but I'm just not ready for that yet. I breastfeed my kids, and I never get pregnant while I'm doing that.
Jen does not rush in to explain about lactational amenorrhea yet. She starts with pointing out something positive and building on what Jayda knows. Notice the many times when Jen validates, agrees, or empathizes with Jayda throughout the vignette.
Well, it's great that you know that breastfeeding is important and great for your kids. And if you're breastfeeding 100% of the time for 6 months, it's a very effective way of preventing pregnancy until your period comes back.
And it's good for losing the baby weight.
Yeah.
I'm truly dedicated to nursing. I tell all my friends about it.
Well, thank you for being such a champion for breastfeeding.
Jen asks Jayda if she has given thought to what she might do after the baby is 6 months old, thereby emphasizing the point that LAM is only effective for 6 months without having to correct Jayda.
Have you given any thought to how you might prevent pregnancy after the baby's 6 months old?
Well, I usually breastfeed longer than that, but yeah, I do get my period after the baby's taking food. So you're saying that nursing won't protect me once I get my period again?
Jen agrees with Jayda, is impressed that she figured it out, and uses a visual aid in plain language to give information about return to ovulation. Then, notice the phrasing and Jen's use of plain language. Your ovary is already back at work putting out eggs.
That's exactly right. So breastfeeding is telling your body that the ovary shouldn't release an egg.
That makes sense. It's like nature's way of helping us not to have too many kids. I love nature.
That's a great way of thinking about it. Can you tell me what you know about ovulation?
Well, I did know that ovulation is when you can get pregnant and you can't get pregnant the rest of the time.
Exactly. And when you get your period, it means that 2 weeks prior, your ovary's been back at work putting out eggs.
Which means you can get pregnant.
Notice that Jayda herself expresses the importance of discussing contraception without Jen inserting any bias or opinion. This is a natural transition to the question, do you have a sense of what's important to you in your birth control method? Followed by paraphrasing. Notice the several times Jen paraphrases during the vignette.
Interesting. Okay, so let's talk about how I can not get pregnant after that happens.
So, do you have a sense of what's important to you in a birth control method?
Well, I'd still be nursing, and I won't take a pill or a shot or anything like that while my baby's drinking my milk. They say that's fine, but that's not fine with me.
It seems like not using something with hormones would be very important to you. And the most effective method that doesn't have hormones is the copper IUD.
No, I've heard about those. I don't want anything or anyone messing with me inside. Sammy will just use condoms if I tell him he has to.
Jayda clearly expresses mistrust with the medical community, likely based on her lived experience or the experiences of people whom she is close to. Her reaction is clear from both her words and body language. Jen is respectful of this. Some people's objection to a device needs further clarification with things like, "Can you tell me more about that?" But in this instance, Jayda is clear.
Okay, so it seems like it would be important for you to have a method that you can manage or control yourself. Is that right?
Jen paraphrases and then offers to discuss fertility-awareness-based methods. Jen does not make assumptions about Jayda's motivation or ability to adhere to a method that requires active participation on the part of the user.
Well, yeah.
Okay. And remind me, your periods are regular every month when you're not pregnant?
Yeah, every 30 days.
Okay. So Let's talk about this method, which is called fertility awareness. Fertility awareness tells you when you might be most at risk for pregnancy and when you're not. Some people also call this natural family planning.
Okay, that's what I'm talking about. Mother Nature.
Yeah, it's all about tracking your periods and ovulation so you can know when not to have sex or when Sammy should use a condom. Seems like that might be something that appeals to you to get to know your body's patterns better.
You know I love to learn about my own body. And Sammy doesn't love condoms, so if he doesn't have to use them some of the time, that'd be good.
Okay, so there's a lot of different ways to do this. One is this app.
Notice Jen's use of visual and tactile aids.
That helps you track things. And then also there is the lower tech method of cycle beads. We have some classes here that you could come to, or you and Sammy could do them together.
Jen asks, what are your other questions about fertility awareness-based methods? Rather than, do you have any questions? Which is more likely to shut down Jayda's questions. Jen doesn't just leave it open-ended, what questions do you have? Because she wants to invite focused questions.
So what are your other questions about fertility awareness methods?
Just before the scene begins, we come into a visit that has already started. Patty asks the first path question, and notice she doesn't ask the T in path, which is the timing-based question, when do you think that might be? She does this because Mia has already said she doesn't see that happening anytime soon. If she had asked the T question, it would show Mia she wasn't listening. Notice Patty's facial expression when Mia expresses joy at the thought of being a mom. Finally, notice that when Patty asks the last question, H, how important, she includes what Mia had said and asks, how important is it to you to prevent pregnancy until you're married?
So do you think you might like to have children at some point?
Oh, yeah. I would love to be a mom someday. But I'm really traditional, and family's really important to me. I want to be married first, and I don't really see that happening anytime soon.
How important is it to you to prevent pregnancy until you're married?
It's really important. But, things happen for reasons, so if it happens, I'll deal with it.
So since you've said you don't want to be pregnant anytime soon, would it be helpful to talk about options for contraception?
Yeah, that sounds great.
Great.
Patty transitions to offer a discussion of contraception based on paraphrasing what Mia has said, and then asks, do you have a sense of what's important to you about your birth control? Mia asks what she means, so Patty gives examples. If Mia had not asked, Patty would have given her 5 seconds to consider the question before rushing in with examples.
Do you have a sense of what's important to you about your birth control?
I'm not sure what you mean.
For example, some birth control methods are more effective than others. They do a better job at protecting you from pregnancy.
Patty uses a visual aid during the examples. Notice the plain language. Some methods change the way your periods come. Then, after she gives examples, Patty asks a follow-up question. Is any of that important to you?
Some methods have hormones in them and some don't. Some methods will change the way your periods come and others won't. Is any of that important to you?
Yeah, when I was looking at this chart, I was just surprised at how differently they all work. I guess I would want whatever works best.
Patty paraphrases using plain language. She incorporates the patient's priorities until you're married, and then asks, do you have a sense of what else you're looking for?
So you really like something that's great at preventing pregnancy until you're married. Do you have a sense of what else you're looking for?
Something natural, without hormones.
Patty doesn't ask why Mia doesn't want hormones. Patty starts with validation and then respectfully asks for more information. Can you help me understand what is concerning to you about hormones? So if Mia's objection had been based on misinformation, she could have addressed it.
I hear that a lot, and different people have a variety of different things that are concerning to them about hormones, and I'm wondering, can you help me understand what's concerning to you about hormones?
I don't want anything that'll disrupt my body's natural rhythms. I try to take care of myself, and I just don't want to put anything unnatural in my body.
It sounds like you'd really be more comfortable with something that's hormone-free.
Yes. I mean, so far, I've been using condoms, but I don't really like how they feel. I mean, when I first start dating somebody, we'll use them until we get tested. I know it's really important to protect against STDs.
Patty validates, then gives information, then points out something very positive. You can see Mia is happy that Patty sees her for who she is. Patty then paraphrases, and when Mia corrects her, she is not defensive and welcomes the clarification, thus increasing rapport while further clarifying Mia's preferences.
Yeah, condoms are a wonderful way to protect yourself against sexually transmitted diseases. And it's an example of what you were talking about taking really good care of yourself, that you're so responsible about getting tested.
Been doing pretty good so far.
So it looks like you're looking for a method that has no hormones and that's really reliable. Do I have that right?
Yes, and that's natural.
Right. Thank you for clarifying. And when you say natural...
Well, like you said, some birth control changes your periods, and I like getting my period. I mean, I like knowing what's going on with my body. So, just being natural.
Patty uses a tactile aid which Mia holds while Patty gives only 2 pieces of information.
Well, this IUD contains no hormones, and as you can see, it's up here at the top of this chart that you were looking at, so it's one of the most effective methods that we have. This is what it looks and feels like.
But don't these mess with your ability to get pregnant later? I thought I read that online somewhere.
Patty starts with positive agreement and then goes on to clarify, rather than correcting Mia or chastising her for believing misinformation online. Patty goes on to make a recommendation for a trusted internet source. She gives a personalized recommendation for bed cider, and only then does she explain the correct information.
I think what you're talking about is the shot. And it could take a while for somebody's natural ability to get pregnant to come back after they stop using it.
I read a lot, sometimes too much.
While I'm thinking about it, there's a website that I think you might really love. Since you like to look things up and you like to keep yourself informed, it's called bedsider.org. And it's all about contraception, and the information on there is all accurate. And it's really actually very fun. This chart that you've been looking at comes from that website.
Oh, great. Well, thanks. I'll check it out.
Yeah, let me know what you think. And just to be clear, all the other methods of birth control, except the shot, once you stop using them, your ability to get pregnant goes back to whatever's normal for you immediately. So you've been really clear that you want to be a mom someday, but that it's important to you not to get pregnant until then.
Patty uses the words up to 10 years to emphasize that Mia doesn't have to use the device for any particular length of time. She adds another phrase that underlines the idea that Mia does not have to use it for the full 10 years and emphasizes the concept that she will remove it anytime Mia wants it out. Patty uses plain language with the phrase, "Your ability to get pregnant goes back to whatever is normal for you immediately," rather than saying, "return to fertility," or telling Mia that she can get pregnant immediately.
And this IUD will work for up to 10 years. But if you'd like to get pregnant at any point before that, or if you'd like it out for any reason, just come in and we'll take it out for you. And then your ability to get pregnant will go back to whatever's normal for you immediately.
Oh, I really hope I don't need it for 10 years. I want to be married before then.
Just as long as you know that you can use it as little or as much time as you like, up to 10 years.
Patty offers to discuss side effects, which is something patients want their provider to tell them about. She then gives only 2 pieces of relevant information and then asks a follow-up question. Notice other times when Patty asks a follow-up question after telling Mia something. This is so Mia can digest the information she has been given and she is not overloaded with information. Notice Patty's hand motions as visual aids.
I imagine you'd like to hear about side effects?
Please, this sounds too good to be true.
So because this copper IUD has no hormones in it, as we said, women will continue to get their natural period, just like they would if they weren't using any birth control. Some women may have heavier periods or longer periods or have more cramps. What are your periods like now?
They're normal, I guess. Sometimes I have to use a heating pad, and that helps.
And you've been pretty clear you don't want to use any hormones. And I'm just wondering if you would be uncomfortable using medication if you got a headache or pain of some kind?
I mean, if I need to, I'll take Aleve. Not the name brand, the generic kind.
That medication, generic Aleve, is called naproxen sodium. And actually, if you use it when you get your period, when you're using the copper IUD, it can reduce the amount of bleeding that you get by more than half. Do you usually know when your periods are coming on?
Yeah, a couple days before I'll get a backache, and so that's why I use the heating pad, and my breasts get really heavy and sore.
Patty empathizes before moving on to give more information. Notice that she neither overreacts nor underreacts. Empathy is best displayed without labeling someone's emotions and matching the level of emotion. In this case, there is minimal emotion from Mia, so Patty matches it.
That sounds uncomfortable. Yeah. So the medication that we're talking about actually can also help with your backache and any cramping that you get.
Oh, that's even better.
So if you want to try this, then what I would suggest...
Patty personalizes the instructions to Mia by including Mia's particular premenstrual symptoms. Patty offers to write a prescription sensitive to the possibility that for some people, prescriptions are less costly than over-the-counter medication.
When your period's coming on, and you know that your period's coming on, you can feel your backache, start taking the naproxen sodium. On the package, it'll say 1 tablet in the morning, 1 in the evening with food. Just double that, 2 in the morning and 2 in the evening.
Okay, got it. But is it okay to take that much?
Yeah, actually, that's the prescription dose. And if you prefer, I can write you a prescription.
Oh, actually, that would be great. It would actually be easier and cheaper for me since my prescriptions are paid for.
Great.
Patty uses teach back, but takes the responsibility on herself by saying, "So I've been as clear as I could be," or "to be sure I haven't left anything out," instead of asking Mia to repeat back what she just told her in order to check that Mia heard and understood, which could make Mia feel patronized.
So we've gone over just a ton of information today, and I want to be sure I've been as clear as I can possibly be and haven't left anything out. Can you tell me how you're going to reduce bleeding when you use the copper IUD?